We have to remember that hormones are a specialty, even a subspecialty. If you were going to see a cardiologist or a neurologist or an orthopedic surgeon, you would want to go to a provider that specializes in that component of medicine.
One thing is to prescribe hormones, and one thing is for us to be able to understand them.
The studies have shown that all hormone replacement therapy has more benefits than side effects. And those side effects present themselves due to that imbalance, to where men and women are not getting the proper dosing. And there are different forms of testosterone replacement therapy.
So many people do get a little afraid of hormones, but you shouldn't be. You just need the right dosing and the proper route.
So just this past year, the black box warning label was removed for women for testosterone. The FDA had this label on testosterone for 22 decades. And yes, we did conquer one huge hurdle in medicine by having the label removed, but now the hard work comes into play by now getting providers trained properly on how to dose and prescribe testosterone for both men and women. I do believe that removing the label is very beneficial. I hope for women, it gives them the confidence and education to move forward with hormone replacement therapy. But we have to remember that hormones are a specialty, even a subspecialty. If you were going to see a cardiologist or a neurologist or an orthopedic surgeon, you would want to go to a provider that specializes in that component of medicine. Tiffany and I have undergone multiple courses and trainings, and we specialize in hormone replacement therapy and are able to provide optimized levels for men and women.
And we also know, in case there is breakthrough bleeding, which I'm sure your OB or your GYN does not know how to treat, we're here for you at any time. One thing is to prescribe hormones, and one thing is for us to be able to understand them. It's okay. Like if you go to your GYN, I'm sure you're going to get hormones, but the issue is what's going to happen when, let's say, your estrogen is too high compared to your progesterone. They're just going to tell you to stop. They're not going to tell you what exactly you need to do. And that's what we do here, right? So we know what to do when there are scenarios when this happens. So if you're experiencing breakthrough bleeding while on hormones, come visit us, come talk to us, leave a comment, or give us a call. So let's talk about the GLP-1s, right? The popular GLP-1s. If you've been taking a GLP-1 and you haven't lost any weight, or you're not getting results, it's most likely due to either dosing, not enough protein intake, right? So you're maybe not eating enough. It's not that you need to stop eating. You do need to eat. You just need to eat the proper amount of food and the proper amount of protein, including carbs. I think we should all be eating carbs. So those are some of the things I'm seeing. I also want to touch on estrogen, since we were just talking about hormones, because estrogen is cancer protective, right? It's good for bone health. It's actually very good for libido. If your estrogen is low, your libido will be affected. It's very good for erections for males as well. So, I see a lot of clinics that do testosterone and they're just giving testosterone with anastrozole. If you're going to a clinic like that, I would suggest you give us a call, and maybe throw your anastrozole in the trash. You may not need it, because you do need estrogen just as much as women do. It's actually really good for bone health as well. Another thing I see quite often is thyroid. So patients are taking a form of thyroid or levothyroxine sodium, which is just T4, right? And we need more than just T4 sometimes. And that's when we get into our labs. And in our labs, we'll see if you have your T4, your T3, if it's optimal or not. You may need a blend. So most of the times we can either just do T3, right? Or a blend, depending on what your levels look like. A lot of even endocrinologists lack that care that we have here, right? So we, like Vanessa said, we do have training in different areas, specifically like thyroid. So if your thyroid is off and they can't seem to get it right, we can dig a little bit deeper, see what your numbers look like, and see if we need to switch you from either levothyroxine or Synthroid into actually a compounded version, or just T3, which is most likely what your body needs. And then a lot of patients also have inflammation or just low grade inflammation, which can be related to your gut health. So we can also check your gut and see what's going on there. If you've been traveling, we want to check for parasites or different bacterial overgrowth in the gut. If you have brain fog, there's many things we can do to check as well too. We check your waking cortisol. We can also do a saliva cortisol test if we see that your waking cortisol is too low, which is something called adrenal fatigue that we can help you treat as well. If your cortisol is too low, we can do a saliva test. We do check your waking cortisol in the morning-ish, and then we look at those optimal ranges to see what it looks like. A lot of people here in the US are burned out, right? It's just the lifestyle we live. So most of our patients will have burnout and they don't know it. So if you're wired but tired, you're not sleeping, you wake up still tired, you're sleeping all night, waking up dragging, you most likely have a cortisol issue. So let's talk about testosterone in males. What I've seen a lot in practice is if you're already on testosterone and you're getting 1 shot a week, there's recent research that shows you don't have to do that. And not only that, even in practice, we can see that splitting that dose a little bit, maybe even 2 or 3 times a week, you keep your levels nice and high instead of having this zigzag, right? Because once you inject once a week, what will happen is your hemoglobin and hematocrit will rise up, your estrogen will rise up, and that's when that anastrozole comes in. Anastrozole is an estrogen blocker. So if we can keep that level nice, this way instead of it doing this, then that's the ideal. That's what we want for testosterone. And in a lot of these clinics now that I see, because there's clinics popping up in every corner. But we've been around for 12 years, and we've been doing it this way. And most of our patients are not on anastrozole. They do not have to donate blood because of our method.
Going back to the black box warning, that was initially placed because the FDA believed that testosterone increased cardiovascular disease like heart attacks, strokes. Tiffany and I have been putting men and women on testosterone prior to the lift of the black box warning. And we've seen that if done properly, dosed properly, testosterone and all hormone replacement therapy, estrogen and progesterone, actually are cardioprotective. They're mood stabilizers. So they help with your energy. They help with your joint health. They help build muscle, lose visceral fat, improve patients' sleep. And we have to remember that hormones are controlled substances. So they do need to be monitored by a provider, one that has specialized in hormone replacement therapy. And if you're getting side effects, that is due to an imbalance. And you do need a proper provider to help properly address that imbalance, whether that be with progesterone, estrogen, and testosterone. The studies have shown that all hormone replacement therapy has more benefits than side effects. And those side effects present themselves due to that imbalance, to where men and women are not getting the proper dosing. And there are different forms of testosterone replacement therapy. You have creams, you have pellets, you have oils, you have injections. And, with our countless years of experience and education, me and Tiffany are aware of the forms that benefit patients, both men and women, the best. And we also keep in mind that maybe not every treatment is per that patient. So we do work with our patients to figure out which form will benefit them the best.
My favorite one, honestly, is either the patch or the injectable. You can mix the testosterone in the estrogen in the same syringe and just inject once a week, right? So that's it. That's all the patient has to do instead of inject it separately.
Yeah, oral estrogen, we do not prescribe that here at Eternity Health Partners. Like Tiffany was saying, the way it's metabolized by your liver is actually what increases women's risk for breast cancer. So there are other forms, like Tiffany mentioned, that are preferred. So here at Eternity Health Partners, we do not put any woman on oral estradiol.
When your provider, doctor, physician, physician assistant, nurse practitioner gives you, let's say, estrogen, if they're giving you oral estrogen, I would ask them why, right? And explain to them what are the risks, which Vanessa mentioned, which is, possible, it can cause breast cancer. And that's why there's so many people do get a little afraid of hormones, but you shouldn't be. You just need the right dosing and the proper route, right? So we can either do the creams, which are very light. You apply it once a day and it mimics the natural production of your own hormones. We have the injectable as well. And then we also have the patches. So those are some of the ways you can take estrogen. And I would ask your provider, why can't I have a patch? Why can't I have a cream? And see what they would say.
Also, kind of what I've seen with other hormone replacement clinics or OBGYNs, you don't want to give a woman that's still menstruating estrogen. If her estrogen is fluctuating, if she's estrogen dominant or estrogen deficient, and she's still having regular menstrual cycles, we need to be balancing that. That goes back to the imbalance of hormones with progesterone. And we have to also figure out, when was her blood work drawn? What day of her cycle was she at when her blood was drawn? Because that's also going to predict where her progesterone and her estrogen are. So if any, whether that be your OBGYN, your GP, or a hormone replacement clinic is trying to give you estrogen and you're still menstruating, that's something you also want to look out for, other than the oral estrogen route.
And maybe testosterone, right? So for a premenopausal woman, right? So somebody, let's say usually the 30s to 40s is a PCOS patient, right? That's why they're going to a hormone clinic or an endocrinologist. Most of the times they're going to have insulin resistance, PCOS, or endometriosis. That's when you're seeing the 30. After 40, it's the perimenopausal. And then somewhere in between there, they become postmenopausal, right? So if you're anywhere from like 30 to 40 and you're having hormonal issues, make sure your doctor's checking or your provider's checking a fasting insulin, right? That's number one. A lot of GPs are not checking. They're just checking a glucose and they just tell you, hey, you're fine. I'll see you later. See you in 6 months or in a year. A lot of things can change in 3-4 months, right? So I would suggest you get your labs checked at least quarterly or maybe every 6 months to make sure, the numbers are moving where it needs to be. And specifically your fasting insulin, a full thyroid panel is very important. Checking your TPO, your TGO to see if you have any autoimmune issues. CRP for inflammation in the body. I think that's another very important one. I mean, all the labs we check are important, but we go more in depth than your GP does.
So here at Eternity Health Partners, just starting off with our very comprehensive questionnaire, as well as our comprehensive blood panel of 9 pages, as well as the opportunity to spend 45 minutes to 1 hour with my patients, getting to know them, addressing some of the main common concerns we see across the board in our patients, lack of energy, poor sleep, their digestion, their nutrition. We're able to address each one of their symptoms, finding the root cause in regards to knowing the blood work, as well as their symptoms. And also, here at Eternity Health Partners, we're not only optimizing patients' hormones, but we're also doing peptide, which is also just accelerating the body, what we're doing naturally at a cellular level, by optimizing that with peptides. And we also offer regenerative medicine. And as your provider, I am able to, if necessary, send out referrals, additional imaging, and diagnostic screening, such as DEXA scans. So if in 2026 you want to optimize your health, prevent chronic diseases, and emphasize longevity, please give us a call at Eternity Health Partners to discuss the next following steps.